Okay, and then, okay, after we did that, then what are we doing?
Check your some breathing.
Do we need to do anything for that?
We've already called 911.
Okay.
The mom is, it's not what we said, we assigned the mom to open the windows and the place out and wait for the ambulance. Well, we're waiting for the phone on speakerphone and do my own thing. Yeah. Freak it out inside.
Yeah, okay. Okay, so information you should provide to 911. So address and location of the incident, phone number, nature of the emergency, so if you can identify that mechanism of action, specifics about the patient's condition if you can. Yeah, so like some people were saying, good idea to have a bystander go out or whatever, phone 911, and then be the one to actually wave down the paramedics, and then make sure that all the doors that they need to get through are unlocked, or if they need entry codes or anything like that. Okay. Okay, so within your workplace, you might also have occupational health staff or on-site emergency services. We don't hear, but okay. So for the primary survey, so after we've done this scene assessment, we've gone through everything, we've contacted 911 if needed. Then we're going to go into the primary survey. So what is a primary survey? A rapid exam to identify life-threatening conditions. So the steps are always the ABCs, so responsiveness first, and then airway, breathing, circulation. So a primary and a secondary survey, we'll talk about a secondary survey later, must be done on every patient seen by the first aid provider. So then this is going to help us assess whether or not it's life-threatening, and then our next steps to go from there as a first aider. So I just want to talk, so if we had 2 injuries, well, we'll talk about this a little bit later, but we have 2 injuries and the ABCs are compromised, so if the person has a bleed but yet is unconscious because of an airway obstruction, we're going to, because the ABCs are compromised, we're always going to address that first. So to check responsiveness, we're going to tap and shout. So either if we don't suspect a spinal or pelvic injury, tapping on the shoulders, tapping on the ground beside, clapping, shouting. So then if the patient moves, speaks, or reacts when you tap him, then he is responsive. And then you can therefore ask them if they need help, and then, identify yourself, do all those steps, ask for consent. If the patient doesn't move, speak, or react when you tap him, then he's then unresponsive. So then you're going to activate 911 and ask others if you need help that are nearby. So for airway, make sure the airway is always open. If the patient is responsive and can speak with you, the airway is open, so that's fine. If the patient is unresponsive, then you need to open the airway by performing a head tilt chin lift. So we can all kind of do this together right now, just sitting here. We're going to do it on the mannequins after. So to open the airway, so if your airway is down here, it's like really hard to breathe. So we're going to put one hand on the forehead and one under the chin, and we're just going to open, 2 fingers under the chin, sorry, open, and then tilt the head back. So that's our head tilt chin lift. We'll practice that lots throughout this course. Okay. And then for the third one, breathing, scan the breathing for at least 5 seconds, but no more than 10 seconds. So before, I know in different CPR there was the lean beside them, see if you can feel them breathing on your cheek. Hard stroke says, no, you're just going to see for 5 seconds whether or not you think they're breathing. If they are breathing normally, the patient is not in CPR. If the patient is unresponsive and not breathing normally or is gasping for air, then they need CPR. You need to then activate the EMS, make sure they're lying back on a flat firm surface, and then begin this CPR 30 compressions to 2 breaths. So for the gasping, people might mistake that for breathing, but the gasping is an involuntary reflex, so it's not considered normal breathing. They still need CPR. it's going to look like they're drawing air in really quickly. They may open their mouth and move their jaw, their head, or their neck. It may sound like a snort, a groan, or a snore. It could be forceful or it could be weak. And it's always in a regular pattern. So, and then circulation. So that's our C in our ABCs. Check circulation by looking for signs of bleeding. Examine the color of lips and skin. Dang it, that's really gutting. It's not 20.